Good afternoon, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist and vice chair and professor in the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team and am the host for Emory's health videos. Today, I'm very pleased to be joined by Dr. David Holland for a conversation about monkeypox. Dr. Holland is an associate professor of medicine at Emory University School of Medicine and is the chief clinical officer for the Fulton County Board of Health. Among the many important tasks and jobs that he has had at Fulton County, I want to point out that Dr. Holland was responsible for starting and running the massive COVID-19 vaccination site that occurred at Mercedes-Benz Stadium in Atlanta. So welcome, Dr. Holland, and thank you so much for joining me today.
Thank you. I'm glad to be here.
Thank you. The monkeypox virus began spreading across the globe in May and has now reached more than 21,000 cases in 78 countries, 71 of which have not been a site for endemic monkeypox. The US has almost 5,000 cases, and Georgia is in the top 5 states with cases in the United States. In Georgia, the majority of the cases have been in the Atlanta metro area, and Fulton County has seen the majority of these cases. The monkeypox virus is spreading mostly through close, intimate contact with someone who has monkeypox. Many, though not all of the reported monkeypox cases, have been among gay, bisexual, and other men who have sex with men. But we want to be very clear on this point. Anyone can get monkeypox regardless of gender identity or sexual orientation. Monkeypox is a legitimate public health issue that is relevant to everyone. We are not aiming to alarm anyone, but rather to inform, as there are methods to reduce potential harm. So Dr. Holland, let's talk specifically about spread of monkeypox. How is this current outbreak spreading, and what are the most effective forms for the spread of monkeypox?
Well, as far as we can tell, based on our epidemiological investigations, it seems to be pretty much exclusively being spread by skin-to-skin contact, and not just casual contact, not like a handshake or brushing by somebody at the grocery store, but sort of prolonged, very intimate contact that you might see during sexual activity or maybe not quite sex, but that kind of an intimate activity. It doesn't seem to be very easy to get, despite the number of cases. It doesn't seem to be something that is very easy to get.
Length of time that someone is connected to someone else and having that contact seems to be really important in the spread of it.
Yes, I think people have been maybe a little bit worried about catching it, like the grocery store or something like that, and that just doesn't seem to be the case. And I also think it's maybe important to mention that in other instances in other like smaller outbreaks of monkeypox that were seen in particular in Africa, a person-to-person spread through droplets has been like COVID or influenza. That has also been a way that it's spread. It does not seem to be spreading that way in this particular outbreak.
Okay, that's good information to know, and really points out how unusual this outbreak seems to be and how it did catch people by surprise. Monkeypox causes a rash that tends to be the most common symptom that people have, and certainly the most common first symptom that people have. As long as you have that rash, can people continue to spread monkeypox to another person if that rash is active?
Yes, and I think it's important to note first that as far as we can tell, before the rash or before the lesions appear, people do not seem to be contagious. That said, the early stages of the lesions can be very small and hard to notice. So I think people may actually be infectious before they know anything's wrong. Even though something's actually there, they may not notice it. The lesions are considered infectious until they heal. They don't have to heal completely, but once they scab over and they start to heal, that's when people are considered non-contagious.
Okay, that's important. In the first lesion or two that someone might get that you may not notice as being something particularly unusual, can it look like a mosquito bite, or will it be really different looking?
I think, the early lesion is a little bump. And it could look like a mosquito bite or maybe a pimple or something. So it can, I think it can easily go unnoticed. And why people who are engaged in the kind of activities that might lead them to be at increased risk of monkeypox might want to be extra careful and extra on alert.
Okay. There's been a lot of conversation about access to vaccines, or more specifically, lack of access to vaccines. I know that you've had multiple vaccine events, and once vaccines get to you, your group is getting people vaccinated as quickly as possible. Who's being prioritized for vaccine, and how are you doing this with your limited numbers of vaccines that you're getting?
Well, so far, the overwhelming number of individuals who have gotten monkeypox, or and the population in which this appears to be spreading, are men who have sex with men who have multiple sex partners. So those individuals are being prioritized. But beyond that, within Georgia and in particular within Fulton County, the majority of cases are now among Black men who have sex with men. So we are kind of extra prioritizing that group of individuals.
Okay.
With some equity efforts to make sure that vaccines get to where they're needed.
I think that's so important to point out that you're focused on the equity of the vaccine distribution, and that is a priority. And Atlanta's outbreak, as far as demographic, is slightly different than it is, let's say, in New York City or somewhere else.
Yeah, that's correct. In other places, it's, vast majority of the people getting infected are white men who have sex with them. But, in Atlanta, that's just not the way it is playing out.
The vaccine can be used as both a post-exposure prophylaxis and as a form of prevention for someone who might be in a community where the risk is a little bit higher. Are you currently providing vaccine for both situations?
Technically, no. We have two allocations of vaccine from the Strategic National Stockpile, and the first is what we call the immediate post-exposure prophylaxis. These are for individuals who have been identified through a contact tracing, through a case investigation, contact tracing, as high risk, as people at very high risk of acquiring monkeypox. So this would be, intimate partners of someone who is diagnosed. And those are individuals that we're trying to get vaccinated within 4 days to actually prevent the infection. And just to mention, the only way to access that is to have your name given to us by somebody who was diagnosed with monkeypox. So just because you happen to know somebody with monkeypox, you can't get it that way. You can't get the access to the vaccine that way. Somebody with monkeypox has to give us your name. The other is what we are calling, what's being called expanded post-exposure prophylaxis. So these are individuals who have had multiple sex partners in the previous 14 days. It kind of looks a little like pre-exposure prophylaxis, but that's actually not what it is. It's actually people who have reported multiple sex partners in the prior 14 days. And those are what the big mass is. So we are holding, that's the group that is prioritized for that. At some point, there may be enough vaccine that we can start thinking about, pre-exposure prophylaxis. But technically, everything we're doing is still post-exposure.
Okay, very good. If someone has recently been infected, so this is going to be a pretty small group that we're currently talking about, but if someone has recently been infected with monkeypox and has recovered, once there's more vaccine available to larger groups, would that person need to receive a vaccine?
As far as we can tell, no. Immunity from orthopox virus infections appears to be pretty good.
Okay.
So there's no evidence that a vaccine would benefit somebody who's recovered from monkeypox.
Okay. That is very different than what we see with our COVID-19 vaccines, which is why it's an important conversation to have. You and I were having a conversation a moment ago about the name of the vaccine and how we pronounce it. Could you pronounce it correctly for us?
Yes, I do. This came from a friend of mine who works at the CDC who's been on international calls about this. And apparently the actual pronunciation is Jynneos. That is the Danish pronunciation of vaccine, I'm told. So
okay. So we want to be clear that Jynneos, a vaccine, takes time before it can protect you. It is a 2-dose series. In your best understanding, how long after being vaccinated should someone be before they reach maximum immune response to Jynneos?
well, the maximum okay, so first of all, we need to point out that the proof of efficacy of this vaccine in monkeypox has only been done in animals and not in humans. There's just been no way until now to test how efficacious it is. It has been proven safe. It's a very safe vaccine. But the maximum antibody response comes 2 weeks after the second dose. Now, that said, in the animal models that they've done, people who have been very recently exposed and then get a post-exposure vaccine get pretty good protection, should get pretty good protection from it. It can be protective against actually getting sick if given within 4 days. And if given within 14 days, it can provide protection from getting it, but less. And but even then it can keep it from being quite as severe. So you do get some protection early. We just don't know yet exactly what that, what the
Okay.
dynamics of that look like. We should know pretty soon though.
I was going to say, we're learning as we go. Again, yesterday it was announced that 800,000 more vaccines are getting ready to be distributed across the United States. They are not yet on their way. Do you have any more information than it's getting ready to be distributed?
The only thing I know is that it's going to be a lot later than we needed.
Okay. All right. Besides getting vaccinated, specifically because vaccines are super limited at the moment, we want to be able to talk about what people can do to lower risk of acquiring monkeypox. What are the steps that you would suggest people do to prevent getting monkeypox at this point?
Well, first of all, I want to just point out there's some really good information on the CDC website about protecting yourself from monkeypox in sexual situations. It was developed by a team at the CDC and the Division of HIV Prevention, actually, and is actually pretty groundbreaking from this, from my perspective, from the type of things that the CDC puts out. I think the most important thing is people are going to have sex and people are going to go to parties and everything, and nobody is suggesting that anyone stop doing that. It does not appear that, well, let me say this a different way. From the epidemiological investigations we've done, the majority of individuals are reporting multiple sex partners. Therefore, one might conclude that it's not necessarily the parties that themselves, these been cases linked to large parties across the country. And then there's been a question about, well, should we just cancel all those parties? Well, no. It's probably not the parties themselves that are the problem. That's just where people go and meet. it, I would say that to protect yourself, just think carefully about, the number of partners that you choose to have, and how they're selected. This might be, a time to dial it back just a little bit. Maybe it's not the right time for, the dark room or something like that. But I would. It's certainly not a time to just stop socializing, and it's not a time to just stop having sex. People need to, live their lives, but just think carefully about the, some particular choices that you make in the process of doing that.
Is it appropriate to have a conversation with a partner about risk and safety in that relationship?
I think it is always important for gay men in particular to have conversations about risk and protection with their sexual partners, no matter what the environment is. That said, I'm also very much in favor of making sure that public health interventions are so widely distributed that those conversations no longer become necessary, because everybody's already been able to access the protective modalities that are going to work best for them.
Yeah.
Unfortunately,
absolutely.
we're just not there yet.
Well, I know how hard you are working to get us to that spot. In these times when people are really overloaded and a lot of misinformation is out there about public health risks, whether they be COVID risks, whether they be monkeypox risks, how do we get folks who are at the highest risk informed and motivated to effectively evaluate their own risk and take appropriate steps to protect themselves and their community without creating additional stigma or unfounded fear?
So that's actually a really good question. And the tack that we're taking is we're working very closely with our CBO partners that serve men who have sex with men in various realms. Whether they're organizations that deal with Black MSM or Latino MSM, or for trans communities, so forth. And working through them to get the messaging out. It works a lot better that way because, they're trusted messengers for one thing.
Mm-hmm.
And then, it kind of tees us up to be able to launch things like vaccines and so forth when they become ready.
Very good. I do have one last very specific question for you. This is a pool time of year. Is there any information about transmission of monkeypox within pools?
As far as we can tell, there's no risk.
Okay.
There's pretty good evidence that the chlorine or the salt water, whatever is killing everything else in the pool, it would kill the orthopox viruses as well.
That's actually a really good piece of information for us to have.
And it's basically August, and we haven't had any cases that have been traced to a pool party. I mean, to actually just being in the pool. So
wonderful. Dr. Holland, thank you so much. I know you are on the ground working to protect our communities, protect and get information out to Fulton County, including vaccines when they come to you. Thank you so much for everything you do, and thank you for being with us today. To all of you watching, please stay safe, and thank you.